Hello, just starting off with some announcements. So your self-check for chapter 1, it's kind of like the end of the chapter thing. That's due by tomorrow night, Friday at the end of the day. We don't have class on Monday for Martin Luther King Jr. holiday. So then Wednesday, whenever we do meet again, your chapter 2 reading will be due before class. That's by 8:30 on Wednesday. And then most days we will have a quiz on the previous information. So Wednesday we'll have a quiz on today's information. So it'll be like 10 multiple choice questions on what we're about to talk about. So chapter 1 is just kind of an introduction, laying the groundwork foundation here for learning more about pharmacology. Your learning objectives, and this is also the study guide, and the study guide is posted in eCampus. It has its own folder on the left side menu that says study guides. So you can download that and kind of fill it in as you go. But these are things you'll want to be looking for as we go through the information. All right, so first of all, just some definitions that we'll go through. So first of all, just what is pharmacology? And all the ologies mean study of, and pharm means drugs. So it's the study of drugs, but not just drugs in general, but what they're made up of, what their properties are, and what they're used for. So we also need to define what a drug is. And typically whenever we think about drugs, our minds automatically go to like addictive drugs like cocaine or marijuana or something like that. But there are a lot of drugs that are not addictive, and they're all great, and they do a lot of things for us. So by definition, a drug is a substance used to diagnose, treat, cure, mitigate, or prevent a disease or condition. So thinking about insulin, of course, is a drug used for those with diabetes, but also for diagnostics. So there are, like if somebody's going in for a PET scan and they have to, take in a radioactive dye, that dye would be considered a drug. It's used to diagnose a disease. So again, drug is a very generic definition that encompasses a lot of materials. So not just addictive things, not just bad things, but again, and not just things used to treat, but also diagnostic or prevention. And then we have a couple different positions here, pharmacologist and pharmacist. A pharmacologist works in the research setting. So they're studying, more of the coming up with the drugs or identifying drugs and what they're used for. So they have knowledge of how drugs work and how to prepare them. So a lot of chemistry goes into that, as well as just scientific reasoning and critical thinking to actually research the drugs. Now a pharmacist, that's what, we think about somebody working at Walgreens or CVS or something. So these individuals work at the hospital or in a retail pharmacy. They are licensed and educated to prepare and also to dispense drugs. So there's a pretty different background and program of study, kind of degrees for these two individuals. So again, pharmacologists don't have to be licensed. Again, they're just working in a research setting. The pharmacist, who is the person who's actually handing out the drugs, and they do have to be licensed. So some of the history of pharmacology. So really, pharmacology goes back a long time. So even the ancient people used different animal parts or minerals or plants, especially for medicinal purposes. So kind of like healing remedies. So this is not something new. This has been around for a long time. Then our Mesopotamians, they actually, on clay tablets, they had kind of described a pharmacist, or apothecary is what they called them back then. So apothecary practitioners, so they described some signs and symptoms of illnesses, also ways of that were prescribed to treat different conditions. So that was even recorded on clay tablets, thousands of years ago. And then the Chinese, who are mainly known for their Chinese herbal techniques. So especially in Emperor Jin Young, even 2000 BC. So again, thinking about like 4,000 years ago, they had these Chinese herbal techniques that were started. Then in ancient Egypt, they produced a medical book of Thoth. This was actually 42 volumes that talked all about methods for healthy living, so preventing disease and that type of thing, as well as the Embers Papyrus had formulas, had remedies, incantations for treating physical and mental illness. And then getting into the AD or CE, we can kind of use them interchangeably here, but Pedanius Dioscorides, he actually termed material of medicine, which is kind of what we think about with drugs, and used plants as drugs. So just a little bit more sophisticated, a little bit more detailed. And then Galen in 129 to about 200 AD or CE prepared different preparations that we still use today that were recorded. He was a philosopher, physician, and a pharmacologist, so multiple things he had going on there. Then as we move into the Middle Ages, we see the monks that were growing different healing herbs. They were translating and distributing pharmacological information to different individuals. And this was also the time at which the first independently owned apothecary shop was established in Baghdad, and that was in 8 AD. Then there was an Arabic, struggling with that word today, documents of the Al-Qur'an that was by Sabur Ibn Sal. So fun words there to say. But anyways, this was something that detailed a lot of drug preparations, how to store them, but also trade routes was included in this for, again, thinking about plants or things like that. So shipping them to other continents or other places. So it included trade routes that were used for those. So getting closer to our modern era here. So the first official pharmacopoeia, kind of like an encyclopedia for drugs, was produced in 1498 in Italy. So this was a set of kind of legal standards for preparing drugs and also for manufacturing or preparing them. Then in 1828, in Germany, Friedrich Wöhler, he actually produced the first synthetic drug, which was urea, that was made from organic materials. So before this time, really everything was natural. It was just using things that were available, mainly, again, herbs, plants, but different minerals. So this was the first synthetic drug, and it was urea in the 1800s. Then in the mid-1800s, we start seeing some more common drugs. So anesthesia from inhalation from chloroform, ether, and nitrous oxide was used in dentistry, but also in surgical settings. This was the first formal pharmacology education program was set up in 1847, again, to license or to educate, not necessarily license, but to educate pharmacists. And also during this time, Oswald Schmeideberg published what was called the Outline of Pharmacology, again, setting up lots of different kind of regulations or procedures for preparing and producing various drugs. So now moving into the 20th century, this was the development of a lot of different types of drugs, again, more synthetic drugs, but vitamins, insulin or antibiotics came about at this time, but also anti-cancer drugs, and then vaccines started becoming available in the 20th century as well. Also enhancement of surgical techniques, so coming up with better ways for anesthesia, but also more sterile environments, and guidelines were made. Being able to control pain, especially again during surgery, was very important in the 20th century. Managing hemorrhaging, so preventing bleeding during surgery, and then also preventing and treating infection before and after any type of surgery that was done. And again, that was thanks to a lot of the antibiotics that were being developed at that time. All right, so again, in class we would have done this, but I want to give you the opportunity. So what I encourage you to do is just kind of pause the video and reflect back, see if you can do this matching, and then we'll go over the answers. But again, highly encourage you to pause it, try to answer them, and see how you do. All right, so the set of legal standards for drug formulas, that was the Pharmacopedia that was made. The apothecary practitioners described on cave tablets. That was the Mesopotamians. The first synthetic drug, which was urea, that was produced by Friedrich Wöhler. The philosopher pharmacologists who made different preps that are still used today is Galen. These individuals made a book about healthy living and also information about treating illnesses with the ancient Egypt. Ancient Egypt. Surgical techniques were enhanced. We saw vaccines and antibiotics being made. That was in the 20th century. The first to use animals, plants, etc. for any type of medicinal purposes, those were the ancient people. Monks were growing their healing herbs, also translating drug information, and the first apothecary set up in Baghdad. That was in the Middle Ages. Termed material of medicine and also used plants as drugs was Pedanius Dioscorides. Chloroform and ether used as inhalation anesthesia. This was in the mid-1800s. A few other things there as well. Began herbal techniques. That was the Chinese Emperor Qin Yung. And then the detailed prep, storage and different trade routes. That was the Al-Quarabian. Right, so now moving into some laws and policies, some different procedures that are in place about drugs. So individual facilities have to set up their own policies and procedures. We'll come back and define what those are here in a minute. But those have to reflect current state and federal laws that are in place. So they can't just make up their own stuff that goes against the law, but they can set up how to carry out those laws. Now, in any situation, so the state and federal laws may not always be the same. One may be stricter than the other. So pretty much the common rule is the stricter rule applies when they're in conflict. So if the state law is a little more lenient, but the federal law is stricter, then they have to follow the strictest of the laws. Surge text, so thinking about your position, it is your responsibility to know and follow all the regulations that pertain to the surgical practice in your particular area. There is also international support, so the World Health Organization. Now they do not have any type of authority over any laws or procedures or enforcing them, but the World Health, or the WHO, their goal is just to develop and try to standardize a set of international guidelines concerning drug manufacturing, so how they're made, how they're stored, distributed, and dispensed. But again, these are a set of guidelines. They are not laws. They cannot enforce them, but it is meant to try to provide some kind of standard in an international way. And they're the ones who publish the guidelines for safe surgery. They did this in 2009, which we're going to talk about next. Again, these are guidelines. They are not laws, but they certainly should be considered. So then some of the kind of history of some of these laws that are in place, so mainly following the federal laws. So the first law really about drugs was in 1848, and this was the Drug Importation Act, and as the name kind of implies, this was talking about importing drugs. So this prevented adulterated drugs from the foreign market from entering the United States. And really, we're still kind of seeing this today a little bit because of, internet sales and stuff like that. And also, if you travel to another country, you can get, antibiotics without a prescription and stuff like that. So this Importation Act was meant to try to prevent some of these drugs that weren't really sure what they were from coming into the U.S. Then in 1902, the Biologics Control Act. This ensures that proper contamination prevention procedures were followed during the manufacturing. So whenever vaccines were made, different serums were made, again, trying to prevent or eliminate contamination. So they kind of set those standards and made it a law to follow them. So then the Wiley Act, or the Pure Food and Drug Act, came about. This was pertaining to the labeling of medications. So before this time, there were lots of elixirs and kind of traveling salespeople who, could make all kind of claims. They could say what was in there. It may or may not be what was in there. It could be anything inside of that bottle. So this Wiley Act made specific requirements for drug labeling. So it set the quality and purity standards as well, that it had some type of standard for what was included in there. And it did require inspection of the manufacturing plants that were producing various drugs, and also the shipment for domestic and foreign drugs. Then the Shirley Amendment came about after that prevented manufacturers and drug merchants from making false claims. Again, before this, they could say that this, is for headaches, or this is for heartburn, or preventing cancer, and they didn't have to have any scientific evidence that that was the case. So any kind of claim was okay until then. Then the Harrison Narcotics Act, this was in the early 1900s. This required a prescription for all purchase of narcotics. So think about opiates and that type of thing. It also regulated the import, the sales, and the manufacturing of narcotics. Then in 1938, the Food, Drug, and Cosmetics Act required all components of a drug to be safe and approved, and this set up the establishment of the FDA. So before that, there wasn't an agency that controlled this. Again, they had to be labeled. They couldn't make false claims, but there was really no one to oversee it or to enforce any of this. And then again, also safety wasn't really an issue. They didn't have to test side effects or anything like that. So the FDA was established to oversee all of this. Then a couple amendments, the 1941 insulin and the 1944 penicillin amendment. These required testing for potency and purity. So again, what was the amount that was needed for it to actually work? Also, purity standards were set up during that time as well. Then in 1970, we start thinking about addiction becoming an issue. So the Comprehensive Drug Abuse Prevention and Control Act was established. So this identified drugs regulated as narcotics, so what was considered a narcotic and what wasn't, and it set up the schedules. So a Schedule 1 drug, Schedule 2. So Schedule 1 drugs are the most addictive, and those with no medical use. Schedule 5 are narcotics, but with very little chance of addiction involved. Then the Omnibus Budget Reconciliation Act, or the OMBRA. This required that pharmacists offer counseling to patients who were receiving new prescriptions, and also written information. So all the stuff whenever you get a prescription, that little pamphlet that comes in it, that is a law. They have to provide that based on this act. And again, pharmacists had to at least offer. So typically whenever you get a drug, you have to click, that you decline consultation, or you had it, or something like that. Again, this is why, because they are required to at least ask if you want counseling or information about the drug. And then the 1996 kind of HIPAA Act, so the Health Insurance Portability and Accountability Act. This is protecting patient rights to privacy. So again, if you go to the doctor or in the healthcare system, you hear about HIPAA. This helps maintain everybody's right to privacy. All right, so again, just another matching here to kind of go back over some of these different drugs. Again, I highly encourage you to pause it, try to write these out, see how good you do, what you remember. So again, pause it, and then whenever you're ready, unpause it for the answers. All right, so our first one, the standards of drug labeling and quality standards, that was the Pure Food and Drug Act. The required prescriptions for narcotics, that was the Harrison Narcotics Act in 1914. Set up the narcotic drug classifications. This was the Drug Abuse Prevention and Control Act in 1970. So again, narcotics were required to be prescribed early in the 1900s, but that classification of Schedule 1 type of drugs, not till the 70s. The patient's right to privacy, that was the HIPAA Act of 1996. Prevent manufacturers from making false claims, that was the Shirley Amendment. Prevented adulterated drugs from coming into the U.S., that was that Importation Act. Required pharmacists to offer counseling to patients, that was the OMBRA Act. Required testing for potency and purity, those were the amendments, the insulin and the penicillin amendments. Ensured proper contamination prevention was the Biological Control Act of 1902. And then lastly, required that all components be safe and set up the FDA was the Food, Drug, and Cosmetic Act. So again, we have the Food and Drug Act, the Pure Food and Drug Act, but then we also have the Food, Drug, and Cosmetics Act. So make sure you don't get those two mixed up. All right, so now looking at some of the responsibilities of the DEA versus the FDA. So if we kind of look at the responsibilities over here, so looking at controlled substances, whether legal or illegal, enforcing those controlled substance laws and managing those classifications. So what is a Schedule 1 or Schedule 2? So that is the job of the DEA, and then the FDA. The FDA is who is actually regulating the drugs, making sure that they are safe and enforces those regulations, inspects the manufacturing, ensures proper labeling, and approves drugs for the market. And again, these go along with those acts. So FDA was established first from that pure drug, or from the Food, Drug, and Cosmetics Act. Then the DEA was set up after the 1970 Control Act and Drug Prevention Act. So again, these both involve drugs but have slightly different roles. FDA is more quality standards. DEA is regulating those controlled substances and narcotics. Now the state law is really just the Practice Act is all that we're going to talk about here. So this identifies the scope of practice. It sets practice limits. So what can you or can you not treat, or kind of procedures can you do within that practice. Defines the responsibilities of the practitioner, what they can and cannot do and what they're responsible for. Sets up the penalties for not complying. And then that leads us into our policies and procedures. Again, whenever a facility sets these up, they have to comply with both the federal and state law. Again, if there's conflict, you follow the stricter of the two laws. But if we look at the difference between a policy and a procedure, a policy is essentially the written rule or plan of action that addresses a specific need, and it requires compliance within the institution. So this is kind of the written rule, what they have to do, their plan for doing it. Then the procedure is actually the steps, so how they're going to carry it out. So the policy is really what they're carrying out, what the rule is. The procedure is how they're going to carry it out. So you have to have a sterile, surgical room. That's a policy. The steps for maintaining that, so how long to autoclave something, what chemicals to use, the step-by-step procedure is then how you carry out that policy. So then we have a few things here. So there are what are referred to as verbal orders as far as their, and they are accepted in practice. So a lot of times, in the hospital setting, there's a prescription or there's something written for how to carry out things. But verbal orders can be used, especially in the surgical setting. So it's just not always practical, especially again in that surgical environment, for a doctor to write out a prescription. Okay, instead, if somebody's on the table and they're like, I need morphine or I need more anesthesia, they're not going to take time to write that into a prescription. So verbal orders are allowed in those, and it is especially a common practice in the surgical setting, and it can be used elsewhere as well, but especially in a surgical setting, it is okay for verbal orders to be used. Now there are quite a few publications involving drugs and medicine. So there's the physician's desk reference that kind of outlines different drugs and what they're used for, what the dosing should be, how long to use them. Then there's also the United States Pharmacopeia, PIA, and that was, again, that was one of the things we talked about earlier that was first set up. So those are still used today. They kind of, again, outline the encyclopedia for drugs. There's the National Drug Code Directory that just, this is more kind of like billing and that type of thing that sets up those codes. The American Hospital Formulary Services that kind of talk more about the drug design, so the formulas used to make them, the kind of chemistry behind it. The Medical Letter of Drugs and Therapeutics. There's also the Joint Commission that is set up to kind of talk about various policies and that type of thing. The National Patient Safety Goals is set up obviously to ensure patient safety. So again, set up kind of guidelines for that. All right, so then, we talked about all of these laws and guidelines and all of that. So essentially what happens whenever that is violated? So as a healthcare worker, you are responsible for these laws. So if you are negligent, what happens to you? So personal negligence, this is the consequences that would be in place if you do not follow these different guidelines. So termination is a possibility, loss of your certification, or potential civil or criminal charges. So again, depending on, and whether it was intentional, whether it was an accident, how likely is it that those events, could have been an accident. Again, was it the first violation? All of those kind of things, but these are all possible for not properly following the procedures and policies of a facility and or following the drug laws, whether state or local, that can happen. And then of course the consequences to the patient, depending on what's going, it could just be a mild consequence or even really no consequences, but of course could lead to death, and that's where potential civil or criminal charges could come into play as well. So again, just kind of ending up here, back to those learning objectives. So again, by this point, you should be able to, define some of these terms, talk about the history, talk about the World Health Organization, talk about the different laws that were set up, talk about the DEA and FDA, differentiate between a policy and a procedure, and how they kind of set those up, and then what happens if you're not following those laws to you, and then also to the patient. So if you have any questions, please let me know.